What are the differences between auditory deficiency and tinnitus? Have you ever wondered about the differences between auditory deficiency and tinnitus? These two conditions are often confused, but they have distinct characteristics and impacts on individuals. Let's break it down in simple terms. Auditory deficiency, which many people call hearing loss, means a reduced ability to hear sounds. This can range from mild to profound and affects how clearly and loudly sounds are perceived. It involves actual impairment in the auditory system, which includes the outer, middle, or inner ear, or the auditory nerve pathways. On the other hand, tinnitus is the perception of sound when there is no external source. This can manifest as ringing, buzzing, hissing, or other noises that only the person experiencing it can hear. Tinnitus is a symptom, not a disease, and it results from abnormal activity within the auditory system or brain. When it comes to the nature of these conditions, auditory deficiency is a measurable loss of hearing ability. Audiologists can diagnose it through hearing tests that determine the degree and type of hearing loss. Tinnitus, however, is subjective. It does not always correlate with measurable hearing loss, but it often occurs alongside auditory deficiency. The causes of these conditions differ as well. Auditory deficiency can result from aging, exposure to loud noises, infections, genetic factors, trauma, or diseases affecting the ear structures. Tinnitus can arise from similar factors, including hearing loss, stress, inflammation, and damage to the auditory pathways. The symptoms and impacts of these conditions are also unique. People with auditory deficiency may struggle to hear soft speech or certain frequencies, which can hinder communication and affect their quality of life. Those with tinnitus may experience persistent or intermittent ringing or noises that can be distracting, cause stress, and impact their ability to concentrate or sleep, even if their hearing is otherwise normal. For diagnosis and treatment, auditory deficiency is identified through audiometric tests. Treatment options may include hearing aids, cochlear implants, or medical interventions, depending on the cause and severity. Tinnitus diagnosis relies on patient history and hearing tests to identify any underlying issues. While there is no universal cure for tinnitus, management strategies can include sound therapy, cognitive behavioral therapy, stress reduction, and addressing underlying causes when possible. It's important to note that tinnitus often accompanies auditory deficiency, especially in cases of noise-induced or age-related hearing loss. However, tinnitus can also occur without any measurable hearing loss. Understanding these differences is crucial for proper diagnosis and management. If you or someone you know is experiencing hearing difficulties or persistent ear noises, it is essential to seek evaluation from a healthcare professional who specializes in hearing health. They can help determine the underlying cause and provide personalized care.